Ethics and the Institutional Review Board. Researchers have a responsibility for honesty and integrity in all phases of the research process. They have an ethical responsibility to do clinical research that is meaningful. There are many ethical dilemmas that researchers need to avoid, like misconduct, such as personal bias, manipulation of data to falsify results, and influencing a subject that results in a change in his or her behavior. We need to protect all research subjects, especially the vulnerable. Vulnerable populations include, but are not limited to, those with low socioeconomic backgrounds, impaired cognition, children, the elderly, and the infirm. Personal autonomy refers to self-determination and the capacity of individuals to make decisions affecting their lives and to act on those decisions. Subjects have the right to decide to participate, not participate, and withdraw from a study at any time. They have the right to full disclosure. Coercion and deception violate the principles of autonomy and respect. Beneficence refers to the obligation to attend to the well-being of others. All who engage in clinical research are required to maximize benefits and minimize possible harm. For example, testing a powerful chemotherapy drug with serious side effects on a healthy subject would be unacceptable. However, testing on terminally ill patients who may benefit from this drug might be acceptable. A study should benefit the participant, society, and healthcare. Justice refers to fairness in the research process, or the equitable distribution of benefits and burdens. This principle speaks to the fair selection of subjects who are appropriate for a given study, drawn from a defined population that is most likely to benefit from the research findings. When you exit the video, you will notice this link has been made available to you. Please take a moment to review the Belmont Report. Informed consent is an ethical principle that requires obtaining the consent of the individual to participate in a study based on full prior disclosure of risks and benefits. Participants have adequate information about the study. This includes the purpose of the study procedures including the time required, risks, benefits, and how will the participant's identity be protected. If a consent form is written, it should be written in the language that the participant speaks, at the level of their reading ability, and avoid the use of medical jargon. It should be clear that participation is voluntary and that a participant can withdraw from the study at any time, for any reason, without fear of penalty. Special consideration is given to vulnerable populations. If a participant is not competent, consent must be provided by a legal guardian or advocate. Regulations regarding children require parental or guardian consent. Anonymity is based on the right to privacy. A research participant has the right to anonymity and the right to assume that the data collected will be kept confidential. Anonymity exists only if the participant's identity cannot be linked even by the researcher. This right is violated when private information is shared without the participant's knowledge or against his or her will. Researchers must specify how they plan to manage private information. For example, paperwork will be kept in a locked file. Data will be de-identified. The researcher's laptop is password protected. When you exit the video, you will notice this link has been made available to you. Please take a moment to review this policy. Choose a partner from your tutorial group to work with. If we have time, we will consolidate the activity to your tutorial groups, so it is important to work with someone in your tutorial. The assignment in class will ask you to review some of the terms, apply IRB classifications to cases, assign Belmont principles to situations, assess risks and benefits, and identify the case with the most risk. Please remember your laptop.